Have you noticed that over time your ankle has become more painful? Perhaps worsening pain on activity. Perhaps it's also become stiff and you've started to notice it swell. Maybe you've got ankle arthritis. It's time to get it looked into. Why do you get ankle arthritis? Well, the causes are different in different people. Some people, their ankle will just naturally wear out over time. And in others, they've had quite a serious accident when they were younger. Perhaps they've had an ankle fracture that had surgery, that required surgery to fix. Sometimes people have had ankle instability before, but haven't done anything to treat it. If you have suddenly discovered that you have ankle arthritis, don't worry, all is not lost. There's a lot that can be done about it. In the early stages, maybe it's just the front part of your ankle that's painful and that's causing stiffness. This is called ankle impingement. A procedure such as an ankle arthroscopy can remove any troublesome bone spurs in the front of your ankle. And it's a very quick recovery procedure. It's a day case operation. You can go home the same day and you can walk on it straight away. All restrictions are lifted and you can slowly get back to normal. If your arthritis is worse and more definitive treatment is needed, then you're looking at two options: an ankle fusion or an ankle replacement. An ankle replacement is a great option. Nowadays, we use CT scans and computer guidance to help put the ankle into people in the most accurate way possible. An ankle replacement requires 2 weeks in a plaster cast, not putting weight through it, and then another 4 weeks in a boot while it all heals up, but weight can be taken through it when it's in the boot. It often requires a one-night stay in hospital, and there's very little pain afterwards. Ankle replacements are quite a new technology. They're not quite as established as hip and knee replacements are, for instance, but they're coming on leaps and bounds. We're now on the 4th generation of ankle replacement technology. In the past, they tended not to do quite so well, but now with the latest technology available, the results are much better. About 80% of ankles are still doing well in people after 10 years. So chances are pretty good for people who are suitable for ankle replacements. Who would an ankle replacement be good for? Perhaps if you're in your 60s and you're not quite as active as you were in your 20s, you're not trying to be a marathon runner or a base jumper, an ankle replacement might be a great option for you. If you want to play around a golf, for instance, or even play some tennis. If you're, however, quite young and still want to be quite active, it might not be the best option for you because it could wear out quite quickly. If an ankle replacement isn't right for you, then an ankle fusion is the way to go. This can be done using keyhole surgery with relatively quick recovery times. You're in a plaster cast for 6 weeks, not putting weight through it, and then in a boot after that, but you can put weight through it then. It's not a painful operation to recover from either, and it requires a one-night stay in hospital. In some people, it's even possible to do an ankle replacement many years down the line after they've had an ankle fusion. If your ankle replacement does wear out, because technology is improving, revision ankle replacements are now possible. So to sum it up, if you've got pain in your ankle, don't suffer needlessly. Book in, come and see me.